Welcome to today's episode. We're diving into a topic that's often overlooked but affects so many: hair loss in women.
Absolutely, it's something a lot of women struggle with, but it's not always openly discussed. Why do you think that is?
I think there's a stigma around it. People associate hair with femininity, so losing it can feel really personal and even embarrassing.
Totally agree. And the causes can be so varied, anything from genetics to stress. Did you know that hormones play a huge role?
Yes, especially things like pregnancy, menopause, or thyroid disorders. Those can all cause significant changes in hair growth.
Right. And sometimes it's even triggered by drastic weight loss or restrictive diets. It's like your body is saying, hey, I need those nutrients.
It's funny, isn't it? We often focus on hair products, but sometimes the root issue, pun intended, is internal.
Speaking of products, a lot of people reach for shampoos or treatments, but those may not help if the underlying cause is something medical.
Exactly. And self-diagnosing usually leads to frustration. Seeing a doctor, especially a dermatologist, is key.
Yeah, they can help figure out if it's something like androgenetic alopecia, which is hereditary, or maybe telogen effluvium, which is often triggered by a major life event.
Telogen effluvium is such an interesting name. It literally means your hair jumps into the resting phase, right?
That's right. Normally, about 10% of your hair is in that phase, but with telogen effluvium, it can jump to 30% or even more.
No wonder it feels like so much is falling out at once. But what about autoimmune conditions, like alopecia areata?
Those are tricky. The immune system attacks the hair follicles, causing round patches of hair loss. Sometimes it grows back, sometimes it doesn't.
That unpredictability must be tough emotionally. I imagine support groups could be helpful in those cases.
For sure. It's not just physical. It takes a toll on confidence and self-image. Even styling choices get affected.
I've read that some women start wearing hats or wigs, especially during periods when the hair loss is more visible.
Wigs can be a lifesaver, honestly. Plus, there are so many stylish options now that can actually be fun to experiment with.
True, but I guess most women would rather have their own hair. Are there effective treatments out there?
Minoxidil is one of the few FDA-approved topical treatments for women. It can slow hair loss and even regrow some hair.
But it's not a miracle cure, right? You have to use it consistently, and it doesn't work for everyone.
That's correct. And if you stop, any regrown hair usually falls out again. So, it's more of a long-term commitment than a quick fix.
What about supplements? There are so many marketed for hair growth.
Most experts say unless you're deficient in something, like iron or vitamin D, supplements usually don't help much.
So, getting blood tests seems important to rule out deficiencies before spending money on vitamins.
Exactly. Sometimes just treating an underlying condition, like hypothyroidism or anemia, can make a big difference.
I know stress is a big factor too. It's like a vicious cycle. You get stressed, lose hair, and then stress more.
That's so true. Managing stress through things like yoga or meditation might not regrow hair, but it can help stop further loss.
And let's not forget about gentle hair care. No tight ponytails or harsh chemicals.
Yeah, traction alopecia is real. All those tight hairstyles can actually pull hair out over time.
It's amazing how even our daily habits play a role. I used to use a really harsh brush, but now I'm much more careful.
Good call. Even the way we wash our hair matters. Gentle massaging instead of rough scrubbing.
Looking at the big picture, it's clear that hair loss in women is complex and very individual.
Absolutely. That's why a one-size-fits-all approach doesn't work. Personalized care is so important.
If there's one thing listeners should take away, it's to get professional advice instead of trying to fix it alone.
And to remember, they're definitely not alone in this. Millions of women are dealing with the same thing.
Hopefully, more open conversations can help reduce the stigma and encourage women to seek help.
That's what we're here for. Before we wrap up, what's one thing you wish more people knew about hair loss in women?
I wish people knew it's not just a cosmetic issue. It can signal something deeper going on with your health.
Well said. And I'd add that it's okay to seek support, whether that's from a doctor, friends, or even online communities.
Thank you for joining us today. If you're experiencing hair loss, don't hesitate to reach out for help.
And remember, hair doesn't define you, but your health and happiness definitely do. Until next time,
Take care, everyone, and keep those questions coming for future episodes.
see you soon.